Hi, my name is Jennifer Schermerhorn, and I am a volunteer community educator with the Alzheimer's Association, part of the Greater Maryland chapter. This presentation is from the Alzheimer's Association's Empowered Caregiver series, and it is called Exploring Care and Support Services. So, in this program, we are going to be talking about why it's important to plan for care changes. We will learn about the different kinds of respite care, informal home and daycare, compare different kinds of long-term and residential care options, describe end-of-life care options, and talk about why it's important when moving a person from one care setting to another, what we need to know about those transitions. And lastly, we will discuss all of the amazing resources that are available through the Alzheimer's Association to help you find the right type of care. So, to get us started, let's talk about preparing for the future. So, preparing yourself for the future by learning as much as you can about Alzheimer's and dementia. And so, it's also important to learn about caregiving as well. This knowledge will help you best prepare for your role as a caregiver. And there are a few little test questions throughout this presentation. And so if we were live, I would ask you to share your answers in the chat of what you think this is. But on average, what percentage of people living with Alzheimer's or dementia are receiving care at home? And the answer is 80%. So 80% of people living with Alzheimer's and dementia are receiving care at home. And so most of this care is being provided by family, friends, or other caregivers who are unpaid. So let's learn a little bit more about Alzheimer's to help prepare for the road ahead. What we know about Alzheimer's is that it is a progressive brain disease. It progresses in three stages. In the earliest stages, brain changes occur, but there are no symptoms. Eventually, the individual will experience problems with memory and thinking as the disease progresses. And health professionals sometimes describe these three stages as mild, moderate, and severe. And they're also sometimes called early, middle, and late. So, Alzheimer's disease does not affect each individual in the same way. It affects people in different ways. Each person living with the disease has a unique experience. And so, we can't always neatly place someone into a specific stage. In fact, some people may exhibit symptoms that are in overlapping stages. Care needs will change and increase as the disease progresses, and eventually the person will need 24-hour care. They will need help with all of their activities of daily living. So that includes things like eating and drinking, bathing, getting dressed, using the toilet, walking, moving from one position to another. So it's really important to know when and where to get help. It can be challenging to care for someone living with dementia, but know that you don't have to do it alone. Resources and support are available at every stage of the disease, and this can help you feel more confident as a caregiver. So, in this presentation, we're going to learn about different care options. Make sure that you check with your insurance coverage before you pay anyone for help. That includes Medicare, medical insurance, or long-term care insurance. These types of insurance may be able to help you pay for care. So I don't want you to pay for anything that you might not have to out of pocket. So, the first care option that we're going to explore is respite care. So, we know that caregiving, while it has its challenges, it can be extremely rewarding, but everyone needs a break sometimes. Respite care gives caregivers that short break from caregiving while someone else cares for the person living with Alzheimer's in a safe environment. Allows the caregiver to get some rest and take care of yourself so that you can ultimately give the best care possible to your loved one. So let's look at the different kinds of respite care. The first is informal help. So caregivers might want to find informal caregiving support. This means getting help from people that you know, like family, friends, and other trusted members of the community, maybe people from your church. Accept offers of help from friends and family. That can be hard to do, right? But accept those offers and tell people exactly what you want help with. A lot of times people want to help, but they don't really know what you need. So be specific and let them know. People can help you with a lot of different things, making appointments, paying bills, or helping to manage the person's finances. Just visiting with the person living with dementia so that you're able to take a break. They can keep them company. Next is home care. So there are also respite services that you can pay for. Not all in-home respite care services are the same. So let's look at two kinds of respite care. Home care professionals usually help with daily living. It does not include medical care. So some examples of home care help would be companion services, help with supervision, sitting with the person, activities that the person may enjoy, visiting with them. Personal care services, helping with bathing, dressing, using the toilet, eating, exercising, other personal care needs. And household services, help with cleaning the house, shopping, or making meals. Adult day centers are another respite care option. This is a supervised place where a person living with dementia can go during the day. Here, they can be social, they can do different activities. A lot of times, they'll do music and exercise programs, and there are trained people that are running these activities. Adult day centers can be a good choice for caregivers who work during the day. While the person living with dementia is at the adult day center, you will have time to rest, run errands, or finish other jobs. And some centers are open 7 to 10 hours, and some even have weekend and evening hours. And often they provide transportation and meals for the person living with dementia. So, unlike home care, which focuses on personal care and help around the house, home health care responds to medical needs. This does require a doctor's order for medical care that is given in the home by a licensed health professional, like a nurse or a physical therapist. A home health care agency usually coordinates this care. Some examples of home health care are wound care, injections or shots, physical therapy, occupational therapy, speech therapy, and even social workers. Next, we'll look at long-term and residential care options. So someday the person that is living with Alzheimer's or another dementia may require more care than you can provide at home. And so eventually they will need 24-hour supervision and more intensive care. There are professionally staffed residential care communities that can give this level of help. These care communities include independent living, assisted living, and skilled nursing homes. So we're going to look at each type of care community in more detail. So let's start with independent living. Independent living centers may be good for people who can still mostly take care of themselves. These centers usually have limited supervision, and many offer social activities, transportation, and other services. Assisted living can also be called things like board and care, adult living, supported care. It's a kind of care for people who can no longer live at home, but do not yet need nursing home level of care. So it usually includes things like housing, meals, supportive services, and healthcare. It is important to know that the federal government does not regulate assisted living homes. And so the words assisted living can mean different things in different states. And not all assisted living providers have programs for people living with dementia. So that's a really important question to ask as you are potentially seeking out this type of service for your loved one. So, long term and residential care. Skilled nursing homes are also called skilled nursing facilities and custodial care. They give care 24 hours a day and they also give long term medical help. Most nursing homes have services and staff for nutrition and food, care planning, recreation activities, spirituality, religion, medical care, activities of daily living, such as bathing, using the toilet, getting dressed, eating. We have social workers on staff. Okay. So now we're going to look at end of life care. End of life care is healthcare for a person who is near the end of their life. There may be many care needs in the final stages of Alzheimer's disease. You may not, as a caregiver, be able to handle these needs without specific help or special help. End of life care services are available. They provide health care for the person living with the disease, and they can also help you as the caregiver. So let's look at these different care services. So, starting with palliative care is specialized medical help. It focuses on relieving the symptoms and stress of the illness. This type of care can help a person cope with side effects from medical treatments. It also provides comfort and support to people living with a serious illness. The goal of palliative care is to relieve pain, control symptoms, prevent side effects and complications, and maintain the best quality of life possible for the person living with the disease. Palliative care also focuses on the quality of life for the caregiver and family who are facing challenges associated with life-threatening illness. How does it work? A team of specially trained doctors, nurses, and specialists work with the person's regular medical team to provide an extra layer of help. This care focuses on the needs of the person. It does not focus on what the disease or illness might do. Palliative care is good for people at any age. They can be in any stage of a serious illness. However, it is usually used near the end of life, and people can receive palliative care with other treatments. The availability of palliative care does not depend on whether a person's condition can be cured. Medicare, Medicaid, and many private insurance plans cover the cost of palliative care. The Veterans Administration offers coverage for palliative care visits and services, but coverage may vary by plan. It's a good idea to ask the person's insurance provider if palliative care is covered. Hospice care is a special type of care that focuses on quality of life for people who are experiencing an advanced terminal illness. Terminal means the person will not get better. Hospice care treats the person and symptoms of the disease rather than treating the disease itself. This type of care also gives support to the family of the person living with Alzheimer's or other dementia. The main goal of hospice care is to provide compassionate care for people in the last stage of a terminal illness. It helps the person manage their pain and other symptoms so that they can live as fully and comfortably as possible. Hospice care includes a specially trained team of doctors, nurses, home health aides, social workers, counselors, clergy, and volunteers. These professionals may ask family members to help them provide care. Most hospice care happens in a person's home, but people may receive it in a nursing home as well. In the US, some hospitals even have hospice units. Hospice teams may offer services such as medical care. This includes medications and medical equipment to help with symptoms and pain. Counseling, the person and family can talk about the emotional and spiritual impact of death. Grief support helps those who care about the person with their sadness. People may feel grief even while the person is still alive, often called anticipatory grief. And hospice can help with this too. 24/7 support. A member of the hospice team will be reachable 24 hours a day, 7 days a week. And respite care. They also provide that, which allows caregivers to take a break. So, hospice care is often provided during the last 6 months of a person's life. It's usually covered by Medicare, Medicaid, and private insurance agencies. And a doctor's order is required for hospice care to receive coverage. The Veterans Administration offers coverage for hospice care, but again, like palliative care, coverage may vary by plan. So it's always a good idea to ask the person's insurance provider if hospice care is covered. So now we're going to talk about some tips for having end of life conversations. First and foremost is to start early. It's important to talk about end of life wishes and choices early. This way, the person living with dementia can be part of the conversations. These conversations can also help you feel more confident as a caregiver as you make decisions for the person in the future. Next, you want to make sure to prepare legal and financial documents. These are called advance directives. These documents include things like a living will and healthcare power of attorney. They let the person living with dementia choose what kind of treatment and care they want at the end of their life. And these documents may also include wishes for comfort care and funeral planning. These documents can help families so that they don't have to guess what the person would want. It takes that burden off of family members. Um, Also, you want to think about the person's quality of life when you make medical decisions. This includes the goals for care and medical treatments, considering each treatment's benefits, risks, and side effects. And I am going to actually, I may have to stop my share real quick so that I can make sure that you can hear this video. So let me update my settings. Okay, so now we're going to hear from an Alzheimer's Association expert about the importance of having end-of-life conversations early.
Having discussions about end-of-life care can be emotional and difficult for everyone involved. Yet there are benefits to having these open and honest conversations, especially in the early stage of the disease. One of the most important benefits is that the person living with dementia has the ability to make decisions about how they want to be cared for at end of life. It can also provide families with peace of mind knowing that they are carrying out that individual's wishes. It's important to remember that these conversations may need to occur over time. It may require a conversation over multiple days, or multiple weeks, or multiple months, and that's okay. I think what's most important to remember is that these conversations occur as early as possible and with the person with dementia whenever possible.
So, when considering the goals for care and medical treatment, remember that situations can be different for everyone. You might choose a person's comfort and better quality of life instead of a longer life, so quality over quantity. Some of these medical decisions may include do not resuscitate. So, a DNR is a legal order that a doctor writes. It stops people from using cardiopulmonary resuscitation or CPR or other life saving procedures to help a person when their heart or their breathing stops. People with a DNR can still get things like chemotherapy, antibiotics, dialysis, or other appropriate treatments. However, a DNR will stop doctors from using CPR or other life saving procedures in certain situations. Life sustaining treatments. Medical care for late stage Alzheimer's disease may include certain treatments to keep the person alive. You may need to decide whether to use, stop, limit, or refuse these treatments for the person. These could include respirators to help with breathing, feeding tubes, IV hydration, antibiotics, CPR, or surgery. Now we're going to listen to another Alzheimer's Association expert who stresses the importance of caring for yourself and relying on others for support as a caregiver.
Unfortunately, this disease requires caregivers to make a lot of difficult decisions. It's important to really go easy on yourself. Take the time to think through your options, make those decisions, and don't forget to rely on others for support.
Now we're going to learn more about moving care settings. People living with Alzheimer's will need different types of care as time passes and as the disease progresses. Sometimes this means moving the person from one care setting to another. It's important to be aware of common changes across and within care settings. A move to a different care setting may be temporary or permanent. Moving can be difficult for anyone, but it can be especially challenging for people living with dementia. Here are two examples of common moving situations for people living with Alzheimer's and other dementias. They might move from one care setting to another. This could be moving from their own home to a hospital or a nursing home, or from a nursing home to an emergency department. They might also move within a care setting. So they may move from independent living to assisted living where more assistance is needed. Here are some ways to help prepare for a move to a different care setting. This can make everyone feel more comfortable. First, plan ahead. Make sure you know how the person's care will change when they move. Communicate with the person living with dementia. Talk with the person before, during, and after changes in care settings, if you can. This prepares them for the move and can help make it easier. Communicate with the new provider. Share all information as soon as you can. This includes things like care preferences, care plans, medical records, and advanced care planning forms. Also, make sure you have open communication. Include everyone involved in the person's care in your written and verbal communications. This includes providers in your current setting and the new setting, providers within an organization, and the person's doctors and other healthcare professionals. Review the person's care preferences and goals. A move is a good time to review treatment preferences, advance directives, and the person's general living situation. Include the person in these conversations as much as you can. Be an advocate for the person living with dementia. Find out the job and responsibilities of each care team member. Build relationships with them. Don't be afraid to ask questions and share your concerns whenever you have them. Whether you're looking for more information on care and support services or you have questions about topics we haven't covered today, the Alzheimer's Association is here for you. We provide a wide variety of information and support for families facing the disease, and all of our programs are free. Starting with our free 24/7 helpline that can connect you with highly trained and knowledgeable staff. They can help with education and decision-making support. They can help you during a crisis. They can also help you find resources. It's 24/7. You will never get a recording. You will always get a live person. Master's level clinicians are available all day and night. They can give detailed care consultations free of charge, care navigation services, and families can use it at any stage of the disease. We offer many local resources as well. So you can find your local Alzheimer's Association chapter at alz.org/find us. We offer local support groups for caregivers, people living with Alzheimer's, and others facing the disease. Some groups are led by professionals, and some are led by specially trained caregivers just like you. The Alzheimer's Association and the AARP Community Resource Finder, alz.org/CRF, is a database of dementia and aging related resources. It's an online tool that can help you find programs and services in your area. Our website, alz.org, has free information and resources for people facing Alzheimer's and other dementias. You'll see there alz.org/care has information for caregivers. The next one, safety. And then there's also one on driving, which offers both of those offering information on staying safe at home and how to know when it is time to have the person stop driving. We also have ALZ Connected, a free online community for people living with dementia and their caregivers, as well as ALZ Navigator, which is an interactive online tool where you can answer questions about your situation, and then it creates an action plan with customized information, support, and local resources. We also offer a number of education programs like this one that you're listening to today. And these programs can help you learn more about the disease and various caregiving topics. And we have free in-person, online, and virtual programs. Um, And then just one last resource that's new and hasn't been added to this presentation yet is that we also have a new app. So if you're looking for a more mobile tool, you can find the ALZ Journey app in the App Store on Android or Apple devices. And that's a really great interactive tool to give additional support as well. And it can be for those who are living with the disease or those who are caregiving. So please do reach out to the organization if you have questions. Again, we have the 24/7 helpline, 1-800-272-3900, as well as our website, alz.org, which has a wealth of information. Thanks for listening.